Cognoa is an AI-based platform to do digital therapeutics and digital diagnostics in the area of behavioral health, and we focus on pediatrics. So we work with autism, working increasingly with ADHD, to empower parents and their primary care providers to be able to diagnose and treat much sooner to get better outcomes for kids and families. Well, my background is in medical device with drug delivery, diagnostics, as well as therapeutics, and I saw a chance to use digital therapeutics and the ubiquitous distribution that you see with digital platforms to really change the standard of care, and behavioral health seemed like one of the most exciting areas to do it, areas where you can get better interactions and thus better compliance and better outcomes through better compliance. And so I had a chance to partner up with a scientific founder, some interesting technology out of Harvard, and put together a company that we think can change the standard of care in behavioral health. I think that the industry has a chance to impact three areas. Number one, the intersection of digital health with AI. And more we're going to move from digital therapeutics or digital point solutions to more integrated precision health. And if you look at the data collection and the engagement that's possible through digital health, and you integrate that with AI, I think there's a chance to really change how care is delivered and care decisions are made. Secondarily, I think there's a huge chance to impact healthcare disparities. And healthcare disparities are the inability for new technologies to impact cohorts that are impacted because of economic factors or geo-maldistribution. And here's a chance to use, once again, the distribution platforms of digital to really bring cutting edge cares to some of the groups that oftentimes don't see it until much later in commercialization curves. Well, I think it really comes down to three things: distribution, adoption, and reimbursement. I think with distribution, you see a lot of companies starting to explore ways to work with both payers as well as to work with pharma and other device providers to really leverage some of the infrastructure around distribution. I think for adoption and reimbursement really go hand in hand. You see that primary care physicians, even specialty physicians, are really overloaded with how many different things that they have to provide to the patients and how to pay for them all. So as we start to work with both payers as well as working with provider communities, I think knitting those together so that digital therapies and digital interventions can become just more standard of care and are reimbursed as part of standard of care, I think that's really going to be the key for having these become widely available. I think it's great because it's taken some of the folks that are early movers in the community and allowing them to share some of those lessons with the broader community. I think there's an opportunity here to develop a whole new sector of medicine and not think of this as just another device company or just some engagement aid for therapeutics, but to really think about how digital medicine is going to become another piece of part of the continuum of care that physicians use. And so I think one of the things that the DTx Summit has done and the conferences have done so well is to bring these people together and start to think about what are some of the lessons that can be learned so that we can try to shape an industry in a way that can really be viewed as a peer by some of the other parts of the healthcare delivery system, as opposed to just a collection of point solutions.